This podcast is for general informational, educational purposes only and is not to be considered medical advice for any particular patient. Clinicians must rely on their own informed clinical judgments when making recommendations for their patients. Welcome, everybody, to another episode of PHM from Pittsburgh. I am still your host, Dr. Tony Tarchichi, MedPeds trained pediatric hospitalist, in case you're new here. I'm at Upmc Children's Hospital of Pittsburgh in the Paul C. Gaffney Division of Pediatric Hospital Medicine. Now, I told you we were going to get a bunch of episodes out back-to-back because we took a few months off because of life, and this is part of it. This is a special episode. This one does not have CME associated with it. This one, we are going to talk about our national conference. Now, as a lot of you know, or most of you who are listening to me are either pediatric hospitalists or work in inpatient pediatric medicine in some way. Every year, we all get together at a national conference called the Pediatric Hospital Medicine National Conference. It's not a great name. Pediatric Hospital Medicine National Conference. This year, PHM21 is different. So I thought we would talk for a little bit on how we put together this national conference. How is it different this year and what's going to be there? Because I'm actually excited about it. Now, before I introduce my special guests, I'm going to do full disclosure, even though we're not CME today. I am on the Phm Planning Committee. So take that for what you will. I was joined a couple months ago due to some issues, and I was asked to be on, and I was happy to do it. But so I am on the Planning Committee as we're talking about this conference. Our special guests are the chairs of the PHM Conference Planning Committee. They are the people in charge of helping put together this conference. So, without further ado, let's introduce our special guests and talk about this conference. So first, we'll introduce Dr. Yemisi Jones. Now, Dr. Jones is an assistant professor of pediatrics at the University of Cincinnati College of Medicine and a pediatric hospitalist at Cincinnati Children's Hospital Medical Center. She has a career focus in medical education with an emphasis on simulation and continuing medical education, including in roles as Institutional Medical Director for Continuing Medical Education and Division Co-Director of Simulation Education. She's also the Society of Hospital Medicine representative to the PHM Planning Committee. Yemisi, thank you for joining us.
Thanks for having me, Tony.
We got three guests today. We're also going to introduce Dr. Anne L. Andrews. Dr. Andrews is an associate professor of pediatrics at the Medical University of South Carolina in Charleston, South Carolina. There, she also serves as a Pediatric Hospital Medicine Fellowship Director and the Director of Advocacy for the Department of Pediatrics. She received her MD from the University of Cincinnati College of Medicine and went on to complete her residency training in pediatrics at Cincinnati Children's Hospital. She earned her MSCR during her Academic General's Fellowship at MUSC. She has a background in health services research with a primary focus in asthma. She currently has funding from an AHRQ to study pharmacy claims-based risk predictors in children with asthma. She's a gun violence prevention researcher and a community advocate working to reduce the frequency of pediatric firearm injuries with a focus on secure storage, counseling, and gun safety education in the community. Annie, thank you for joining us.
Thanks for having me.
And last but certainly not least, Dr. Rachel Merrick. Dr. Merrick received her medical degree from the University of Michigan in 2003 and then completed her residency at Children's Hospital of Los Angeles. For 10 years, she worked as a community pediatric hospitalist at Santa Rosa Memorial Hospital, acting as medical director for 8 years, as well as department chair for 2 years until she transitioned in July of 2016 to Texas Children's Hospital, The Woodlands, to become the medical director of the Pediatric Hospitalist Program. Dr. Merrick has been very involved with community pediatric hospitalists, co-chairing the American Academy of Pediatrics section on hospital medicine community hospital subcommittee with Dr. Jeff Brown from April 2012 to July 2016. She also served as a member of the National Leadership Team on Pediatric Hospital Medicine Certification. Dr. Merrick currently is an elected member of the American Academy of Pediatrics section on Hospital Medicine Executive Committee. She has spoken at a number of regional and national conferences and focuses her non-clinical time on advancing community pediatric hospital medicine as well as leadership development. So, Rachel, thank you very much for joining us.
Thank you so much, Tony. We're all so excited to be here today.
This is fun. The conference is usually a good, fun time. Unfortunately, this year it's not live, but I was wondering before we start, Annie, would you mind walking us through how this conference comes into fruition, because I think a lot of people think it just kind of happens, and that is not the case.
You couldn't be more right about that, Tony. So this is my third year on the Pediatric Hospital Medicine National Meeting Planning Committee, and I have learned a lot about the meeting planning process through this experience. So you're right. The group starts meeting right after one meeting, we start planning the next meeting. So it really is a 12-month process of meeting planning. And what I love so much about it is it's a great opportunity for networking. So we have representatives from the AAP, the APA, and SHM all join the planning committee and work together for 12 months to put on the next PHM meeting. And an exciting addition we made last year was we also bring a fellow onto the planning committee every year. So it's a very collaborative group of pediatric hospitalists from all around the country representing those three organizations. And then, of course, we work with the outstanding staff of all three of those organizations who really do put in the hard work throughout the year to bring us this meeting.
Now, if I could ask Yemisi, how much more difficult is it to plan a virtual conference than a live in-person conference, or is it easier?
Tony, it's definitely not easier. And I think, obviously, the past year has been unique in its challenges. And so we actually started planning an in-person meeting. We started the year with really high hopes and then had to make the call around December to switch to virtual meeting planning. So I do think the truncated time course also made it a little trickier for us and was a little bit more challenging. But the meeting that we're planning this year has all the components of our typical in-person meetings. And so it has that same level of work. And then on top of that, of course, we have the technical platform we have to consider, and how do we make it feel like a meeting? How do we make, some of those things that happen naturally in person occur virtually? So if I had to say, all in all, I think it's probably more work to do at a virtual meeting, but it's been great fun to plan it with this wonderful group of folks.
Now, Rachel, would you mind letting us know some of our plenary speakers this year, for those who don't know, maybe who they'll be, who you're most excited about hearing?
Well, I think I fall in the camp with most everybody else. I am very excited to hear from Dr. Spears and Fauci. They are, our up and coming number one sort of plenary speakers this year. And we have a lot of good questions. We asked the listserv for questions. We asked the planning committee for questions. So Yemisi is going to be moderating that session, and we're really excited to hear from both of them. Both how do we plan for safe school reentry for children this fall, as well as kind of where do we think we're going with COVID? What are these new variants? What do we need to think about? What are specific issues for pediatric hospitalists? I would say in addition to that, I'm really excited about Nathan Chamillo, who's coming to us from Minneapolis to talk to us about structural racism and how do we go from advocacy to action. And, we wanted to honor the fact that PHM21 was supposed to be in Minneapolis. And we wanted to honor the fact that that was a place where there's been a lot of upheaval and discussion after the murder of George Floyd. And I think this was a really wonderful way for us to come together as a community and to learn and grow together and continue to have these discussions in pediatric hospital medicine. And I think, like everybody else, we're always excited for top articles. And I know John Morrison and Rhonda at Chulona are very excited about giving this talk on Friday. I got to preview their slides on this past Friday, and I already feel smarter, but I know I'll feel much smarter after I listen to their talk on Friday.
Now, for those of you listening who don't know, Dr. Beers is the president of the AAP. She'll be on with Dr. Fauci for one of our plenary speeches. But it couldn't have come at a more opportune time with the Delta variant rising. There's going to be a lot of questions, and I can't think of two better people, short of the director of the CDC as well, to sit there for us and answer these questions. When this happened, we weren't in this big Delta surge. So do you expect most questions are going to be based around, Delta virus and COVID and school time? And I'll kick that out to anybody who wants to answer.
Yeah. So we only have 30 minutes with these very busy people. So we will need to focus the conversation. And that is, I think, what's top of mind for most of us, is, with the changing
epidemiology, with a changing environment. What does this mean for our patients? What does this mean for kids as they start school? So yes, I think the conversation will mostly focus around school openings and some of the discussions around masking and not masking, as well as what Delta means and what the future may hold with, a very busy summer season of respiratory viruses. What the heck can we expect in the winter if we can prognosticate that?
Oh, that'd be great if they could. Now, the other thing I'm excited about, we got a lot of really interesting workshop submissions and abstract submissions. And, in a year where it was going to be virtual, I wasn't sure how many we'd get. We got a ton, and some are just really superb, but I'm looking forward to it. And Annie, can you talk about that a little bit?
Yeah, so I think it's just a huge testament to the work that everybody in our community has been doing, despite all the additional stress we have all been under. I was blown away by the amount of content and the quality of content that was submitted to the meeting this year. And it really just makes me so proud to be a member of this committee. In this community. In particular, as a researcher, I am exceptionally excited about our full research abstract sessions. A lot of new up-and-coming researchers are going to be presenting their work, a diverse range of work. And of course, we also have the big research plenary session for those top scoring research abstracts. So I'm really excited about that as well.
Now, every year when I go to this conference, I enjoy going, but what I don't enjoy, and I'm being very honest, is buying the plane ticket, going to the airport, getting the hotel room. I don't enjoy traveling. I'm much more of a homebody. So I am actually excited this year to be in my house or at my office for the conference. But for a lot of people working, especially in the community hospital setting, they have a hard time getting off to come to the conference because the hospital has to be covered. I know a lot of my listeners are in smaller groups and smaller institutions. This is an opportunity. They can actually see the conference because I believe you can watch it up to 3 months after you pay for it. Is that right, Rachel?
Yeah, that's true. And I think you're right, Tony. It gives a lot of people in smaller institutions. I came from an institution before being at Texas Children's that, we had 5 or 6 people. Well, you can't let all 5 or 6 people go to the conference. So, maybe 2 or 3 or 4 of us might be able to go every given year. And so I think this is, we talk about the new normal or a changed normal. And I think regardless of when we all hope to be in person one day. We all hope that one day we'll be able to come together. And next year we hope to be in Orlando together. But I think this does give us an opportunity to really think about what have we learned from the pandemic that is positive and that we can move forward with. So I'm hoping that the virtual component stays even when we come back in person, because I do think it allows many more people to join and to join the community. And hopefully, to Annie's point too, enjoy networking opportunities. This platform has a lot of great opportunities to network, to come together, to meet individually, to meet as groups. So utilize the technology. Now, having said that, I am the most technologically incompetent person probably on this call today. And so I am every day trying to figure out how to utilize the technology. But I think that this is a really great opportunity for us to come together and to see one another and join in a virtual way. And like you, Tony, I like to travel, but I would say that I'm excited about being in my loungewear and hanging out on my couch in my office or wherever, and not worrying about getting on an airplane and checking into a hotel and pulling myself together every day.
I am not with y'all on that. I love getting on the plane. I like going through security. I like checking into the hotel. I like sleeping in a bed without my kids and my husband sometimes. Oh. I am definitely missing the in-person meeting, but I totally appreciate that there are many in our community who are like you and are happy to have less hassle.
Well, everyone's a little different. I don't enjoy travel, but I will say for those listening, I always say on the podcast, we don't do any advertising on the podcast. It's a CME podcast. This is the same. I'm telling you about a conference that A, I was a part of planning, but B, I go to every year because I'm a pediatric hospitalist. This conference gives me a lot of information about what's going on, things that I can't get to all of it, even with the podcast itself. Give the top 10 articles I always really enjoy seeing because I may have missed a couple. So just so my listeners are aware, this isn't an advertisement for the for the PHM21. This is just simply telling you about something that I do every year. Now, that being said, I wonder if we can go around the horn, starting with Annie. Give me the thing you're most excited about seeing at this year's conference. and maybe we'll get out of here on that. Annie, you're up.
All right. I'm just excited about the whole thing, to see all the amazing work everybody is doing. And we haven't already mentioned, but I'm super excited to hear from Dr. Julie Silver, who will be talking about gender equity in medicine, which I think is such a critical topic for us. And so many great people in our field are doing work in that area. And so it's just an honor to have Dr. Silver join us this year.
Yemisi, we'll kick it out to you then, Rachel.
Yeah. In addition to what's been said already, I am also really excited just to see everyone. Last year we had to sort of scramble and make a virtual conference that was not as interactive as this year's will be. And so I'm actually really excited to see old friends and to catch up with folks. We'll have lots of great networking sessions where we can pop into a room and you can set up individual meetings. We'll have some fun stuff too, like hip hop and cocktails and that kind of thing. So I'm looking forward to that. Also the non-serious side of PHM this year.
Well, I can't disagree with these two wonderful ladies. But I will add, in addition to that, I'm really excited about Phm Stories, which is something new that we're bringing this year, which I really think has given us an opportunity to really dive into the heart of PHM, what brings us to what we do every day, to what drives us, what holds us together, some of the challenges our communities faced over the past year plus, but also some of the just really heartwarming stories that people wanted to share. I think this is just a great opportunity for us to become a little bit more personal, to get to know our community and know what people have gone through over the past year. And so I'm really looking forward to hearing these stories. All of us on the planning committee have gotten a chance to at least preview some of them. And I think it's just such a wonderful opportunity to hear from the people who are working in the trenches every day and who are bringing such amazing work to their jobs and to their hospitals each and every day.
I'm also excited for the PHM stories. I think they're very heartwarming, and it just humanizes all of us, that we're not just doctors working, we're people. And I have to tell you, I'm most excited. I'm going to fanboy out to see Dr. Fauci and be able to him to answer some of my questions. I tried to get him on the podcast. He was a little busy, so I couldn't get him on. But I'm excited to see him. I'm excited to hear him talk. On that note, is there anything else we didn't bring up that you all wanted us to bring up for the conference that we missed?
Yeah, I would just add that if you haven't signed up for the meeting and you are interested in attending, today or tomorrow, Tuesday, is the last day to sign up to attend it live, meaning engaging with the networking, participating in workshops. After that point, you will be able to sign up on demand, and you can certainly watch the recorded sessions after the fact. But tomorrow, Tuesday, is the deadline, if you still haven't registered or are thinking about it, to register for the live virtual meeting.
And I would just say, if you can do this, block your calendar. Enjoy these 3 days. Make it like you're at a conference. I told people at my job, I put my out of office in starting Wednesday, and I told people to give them the heads up, hey, I'm not going to be available for meetings. So if you can do that, try to take the time to really enjoy the conference as you would in person. I think we all agree we'd much rather be in person if we could, but we're not this year. And so take this opportunity to really enjoy 3 days of great content, but also great networking and great coming together of our entire community.
And I'll just quickly say, for the junior faculty and the fellows out there, this meeting is what you make of it. So engage as much as you can with the other attendees, and I think you'll get more out of it that way. And we really look forward to hearing from all of you across the week.
And I will tell you, we are podcasting from the conference this year. So if you see me, feel free to send me a message saying hi. We will be looking for people to do what I learned at the PHM conference today. I'd love to get anybody who's there, who's attending. So feel free to shoot me a message. And as always, it'll be exciting to see you guys there. And thank you all very much. Annie, Yemisi, Rachel, thank you for coming on. I really appreciate your time.
Thank you so much.
Thank you.
Appreciate the invite.
I want to do a quick acknowledgements to UPMC, Children's Hospital of Pittsburgh, for continuing to support this podcast, along with the University of Pittsburgh, who normally supports us with free CME to all the listeners. I want to thank you all who keep listening to me week after week as we make new podcasts. I really appreciate you doing it, letting us come into your earbuds or your car. I also want to thank Dr. Megan Tarchichi, who continues to help me with everything. I really hope to see you all at the conference, everybody. Have a great day.